Welcome to Start to Career 2.0 online nursing channel. In yesterday's video, we have discussed 10 important questions for AIIMS NORCET Exam 2024. So this is the question challenge round 2. In today's video, again, we are going to discuss another 10 important questions for the upcoming AIIMS NORCET Exam 2024. So let's begin with the first question of this video. What should the nurse do first when a client with a head injury begins to have a clear drainage from the nose? Option A, compress the nas. Option B, tilt the head back. Option C, collect the drainage. Option D, administer an antihistamine for postnatal drip. The right answer. So a nurse should do the first when the nurse sees there is a clear drainage from the nose for a client who have head injury. The right answer is collect the drainage. Why, why the drainage need to be collected? The rationale. The nurse should first assess whether the clear drainage from the nose is cerebrospinal fluid. By checking for the presence of glucose or connecting a test to confirm, it's important to notify the healthcare provider immediately if CS is suspected, as this may indicate a more serious injury. Moreover, the client should be kept in a semi-thalamus position to help to reduce the intracranial pressure. So I hope you understood about the explanation for the first question. Now let's move on to the question number 2. Which of the following is a normal respiratory rate of a newborn? Option A, 30 to 60 breath per minute. Option B, 20 to 50 breath per minute. Option C, 40 to 50 breaths per minute. Option D, 50 to 80 breaths per minute. The normal respiratory rate in a newborn is the right answer. Option A, 30 to 60 breath per minute is the right answer. And the explanation here, the normal respiratory rate for a newborn is typically between 30 to 60 breath per minute. It's important to monitor for any signs of distress or irregularity in their breathing. And in such case, the nurse should consult with a healthcare professional if there is any problem. The question number 13, the question in this video. Ramu, the ward boy, is taking out the trashes when struck by a needle injury. What is the appropriate next step for house servant Ramu? Option A, wash his hands with soap and water for 15 minutes. Option B, obtain the needle and place it in sharp container. Option C, report the incident to the charge nurse in the ward. Option D, report to employee health immediately. So if a house servant who is cleaning the time he got injury with a needle, the nurse should do first for this client is ask him to wash his hands with soap and water for 15 minutes. So while we wash the hand with soap and water for around 15 minutes, what will happen? The correct step is to wash the hand with soap and water to reduce the risk of infection, and he should then apply an antiseptic and cover the area with a sterile bandage. If there is any concern regarding exposure to bloodborne pathogens like from the needle, he should seek medical attention promptly for further evaluation and possible post-exposure prophylaxis. So I hope you got the explanation for question number 3 answer. Now we move on to the fourth question. This is an image-based question. The type of presentation shown in this image is option A, occiput presentation, option B, face presentation, option C, brow presentation, option C, vertex presentation. This type of presentation shown in this image is option C, brow presentation. What is brow presentation? Brow presentation is a type of abnormal fetal presentation during childhood. where the fetus head is extended backwards, such that the forehead is the presenting part rather than the crown vertex of the head. This can complicate labor and delivery, potentially leading to increased risk for both mother and baby. It is typically managed with careful monitoring and depending on the situation, a cesarean section may be necessary if the baby does not rotate to a more favorable position. So this is the clear explanation for brow presentation. Now we move on to the next question in this video. Question number 15. Which of the following is not a modifiable risk factor in the case of diabetes? Option A, age. Option B, sweet intake. Option C, obesity. Option D, alcohol intake. So, which is not a modifiable risk factor in the case of diabetes mellitus. The right answer is option A, age is not a modifiable risk factor. You cannot modify the age of a person. So the explanation, non-modifiable risk factors includes age, genetics, epigenetics, and social determinants of health, including the education level, socioeconomic status, and noise and arsenic exposure. The modifiable risk factors includes obesity, microbiome, diet, cigarette smoking, sleep duration, sleep quality, and sedentary behavior. So I hope you got it. Now we move on to the next question. In the ECG, the P wave represents option A, atrial depolarization, options B, ventricular repolarization, option C, ventricular depolarization, option D, atrial repolarization. So the P wave represents what? It represents option A, atrial depolarization. Atrial depolarization. The explanation we can see here in ECG, the P wave represents atrial depolarization, which is the electrical activity that triggers the contraction of the atria in the heart. So due to that, the P wave arises. In ECG, atrial depolarization is the right answer. Move on to question number 17. Which part of the mind is associated with the practical reality principle? Option A, id. Option B, ego. Option C, hyperego. Option D, superego. So in the Sigmund Freud structure of mind, the part which is associated with practical reality principle is option B, ego. Option B, ego is the right answer. So let's see the explanation. The part of the mind associated with the practical reality principle is the ego. According to the psychoanalytic theory, the ego mediates between the desires of the id and the constraints of reality, making it responsible for realistic and socially acceptable actions. So I hope you got clear with the part which is associated with the reality principle in the mind, that is ego. Move on to the 18th question. While administering the COVID 19 vaccine, which method will you use to ensure that vaccine stays in the muscle and does not leak back into the subcutaneous muscle? Option A, inject at 90-degree angle. Option B, leave the needle in the muscle after injection for 10 seconds. Option C, aspirate before giving the injection and give only if you aspirate blood. Option D, Z-track method. So while giving COVID-19 vaccine, the best method to administer the vaccine so that the medicine could stay in the muscle for a long time by preventing it getting from subcutaneous muscle will be the right answer is option D, Z-track method. Z-track method is the right answer here. The explanation here, the Z-track method is used when administering the vaccines such as the COVID-19 vaccine to prevent the medication from leaking into the subcutaneous tissue and to minimize irritation. This technique ensures that the vaccine is delivered deep into the muscle and remains there, which can enhance absorption and reduce discomfort at the injection site. It is particularly beneficial for vaccine that may cause irritation and for that require proper intramuscular delivery for its efficacy. So for this reason, we use the track method while administering COVID-19 vaccine. Now move on to 19th question. The following are high risk when administering an enema to an older adult, except option A, hypocalcemia, option B, sepsis, option C, hyperphosphatemia, option D, bowel perforation. So while administering enema to a older adult, what is the highest risk of getting complication? The except the here is all three are the higher risk complication except one thing. So we have to find out what is that. The right answer here is option A, hypocalcemia. Hypocalcemia is not associated with a complication of enema in older adults. The explanation here, administering an enema to an older adult carries several high risks, including dehydration, electrolyte imbalances, bowel perforation, and adverse reactions due to underlying health conditions or medications. Older adults may have weakened health, making them more susceptible to complications. So, in this case, consult with the healthcare professionals before proceeding with any enema administration for older adults. So, hypercalcemia is more common. Hypocalcemia is not a common complication while administering enema to older adults. Now, let's move on to the last question in this video, the 20th question. The feeling of child movement by the mother is called as option A, lightening, option B, ballotment, option C, engagement, option D, quickening. The feeling of child's movement by the mother is called, you all know very well, option D, quickening. Quickening is the right answer. So the explanation very simple. The feeling of a child's movement by the mother is known as quickening. This typically occurs around the second trimester of pregnancy when the mother begins to feel the fetus moves inside her womb. What is ballottement? It is a medical sign which indicates increased fluid in the suprapatellar pouch over the patella at the knee joint. Both lightening and engagement are natural process that indicate that body's readiness for labor and childbirth. While they can be comfortable at times, they are positive signs that your baby is getting ready to make their grand entrance into the world. So, with this, we have come to the end of the challenge round for AIIMS NORCET exam. And again, I will bring another 10 important questions in my next video. So I hope you all enjoyed this 10 questions. I hope you get benefit from this 10 question. Please don't forget to like this video and subscribe my channel, Sat2 Career 2.0 Online Nursing channel. Very soon, we will meet with another 10 important questions. Till that, thank you all. Bye bye.